I'll tell you, in my experience as a psychotherapist, I mean, you know, I can tell you some of the things that make people sick. A lot of them have nothing to do with the psyche. The things that make people sick are, well, they get unemployed. It's like unemployment just lays people out, especially if they're conscientious. They just devour themselves, and it's so stressful, right? Because if you're unemployed, well, your finances become shaky almost right away, plus you don't have any routine, plus you're not involved in anything meaningful in relationship to society, you know, and then you start to eat yourself up with doubts and you know, self-criticism, especially if you're a conscientious person, or especially if you're a conscientious person who's high in negative emotions. Like unemployment will just flatten you. And then the death or illness of yourself or a close relative, that's really hard on people. And there are situations at work that are difficult. So people are bullied. Maybe they have a terrible supervisor, or they're in a pathological social structure, so that, you know, they're basically being bullied and oppressed with every step they take, or they're in a very horrendous relationship. But then things start to turn a bit. So, okay, so you can lose your job and you can be ill or dying, and so can people around you, and that'll lay you low a lot of the time. And no wonder, right? It's logical. And when people come to me with those sorts of problems, the first thing I often note is they're not psychological. I tell the people that. That's not a psychological problem. You're unemployed. That's an actual problem. And it's really useful to distinguish those, right? So for example, and this is something that psychiatric diagnosis does very, very badly. If someone comes to me and they're depressed, so they're not sleeping properly, they feel terrible in the morning, you know, they don't have a lot of energy, they're having a hard time experiencing any positive emotion, it's difficult for them to move, and they have a lot of negative thoughts about the past and the present and the future. I do an analysis of their life first to say, well, you know, do you have a job that's, you know, all right, that you know, that at least isn't horrifying? You know, is it okay for you to go to work in the morning? Do you have an intimate relationship that's basically functional? Do you have some friends? You know, are your relationships with your family members okay? Are you reasonably healthy apart from the depression? And do you have useful and interesting things to do that aren't related to your career? And if the person says yes to all of those and they're still feeling terrible, then I think, okay, this person is depressed, right? Because they don't have a problem, they're just depressed. And in my experience, those are the people who respond quite well to antidepressants. You know, because their nervous system isn't calibrating its analysis of their situation to the reality of the situation. It's as if their lower status, according to their status comparator, which is a very primordial thing, since even lobsters have it, their status comparator isn't paying attention to their actual status. And maybe that's because they're, you know, temperamentally high in negative emotion, or maybe it's because they had been traumatized earlier in their life, and so they're much more sensitive to any signs of failure. It's easier to knock them down. But then you have the other people who are, well, they don't have a job, and they never have, and maybe they're 30 or 35, no real stable employment history, no real educational history, it's pretty patchy, one or more illnesses, and then family members who are just out for their absolute destruction. Like, families can be unbelievably pathological, so they're enmeshed in a familial situation where, for one reason or another, as soon as they get up off the ground a little bit, someone knocks them back down. And so, and then maybe they have a drug or alcohol problem to go along with that, or they have a relationship with someone who has a drug and alcohol problem or a mental illness. And sometimes you see people who have like all 5 of those things going on at the same time. It's like, that's not precisely mental illness. Now, a lot of that's associated with deceit. You know, they're entangled in relationships and in relationships with themselves that are pathologically untrue.
You cannot feel depression, anger, guilt, or shame when you're connected to life. Or in my definition, being connected to life means when you're in touch with your needs. So I've asked many very depressed people, who are very good for building up your income if you're in private practice, because 41% of pharmaceutical sales in the United States are for antidepressant medicine. So 41% of pharmaceutical sales are for antidepressant medicine. So now, does this mean we have a disease called depression that's rampant? Or are we systematically educating people in a way that makes it inevitable that almost everybody will be depressed, and the people who end up getting called bipolar, just they're better at being depressed than the others? So I would ask this question of people when they would come in to see me for depression. I'd say, can you tell me what needs of yours aren't getting met to your satisfaction? I'm a failure. Really, this would be exactly the kind of answer I usually get. I'm a poor mother. I've been, my brother is this and I'm just this. So I'd ask for needs, but they're not in touch with needs. You go up and think there is. If you want to be depressed, be a man and think there's such a thing as a competent man. You want to be depressed, be a woman and think there's such a thing as an attractive woman. That's all it takes to be really depressed. But if you really like to be depressed, not just semi-depressed, not only think of what is wrong with you, but compare yourself to others. And if you don't know how to do that, get a hold of a book called How to Make Yourself Miserable by Dan Greenberg. Now, this book really produces. You think you can get yourself depressed, but boy, if you read this book, you can really get depressed. For example, one of the exercises in the book, one of the chapters, is how to compare yourself to others. And in this chapter, the first thing you see as you turn to it is a picture of a man and a woman by contemporary standards who would be judged as quite attractive. Now, they're without clothes, and they have all of their measurements on the picture. The exercise is this. Take your measurements, compare them to these attractive people, and think about the difference. Now, some books promise that they don't produce. Now, you do this exercise, and it produces. You'll be about as depressed as you think you can get until you turn the page. Now, when you turn the page, the author says, now, this was just a warm-up, because we all know that beauty isn't that important. Now, let's compare ourselves to other people on things that are important, such as achievement. So to help you in this exercise, the author claims to do this. He said, I have called people at random from the phone book and asked them what they have achieved in their lives, at what age they are, and now you can compare yourself to these people. Now, here's where I'm not sure I trust the author of this book, because the first person he claims to have called at random from the phone book was Mozart. But there were some interesting facts about Mozart I never knew, like how many languages he could speak by age 8, I forget the number, and how many pieces of music he subsequently wrote that have been handed down over the centuries as masterpieces. Now, compare what you've achieved at your stage in life with what Mozart did by age 8. And think about the difference, you see. So, and you'll get this kind of indoctrination moment by moment watching the television, of course, because this is showing you what the normal, appropriate, attractive, competent, successful human being is doing, what they have, what they own. See, that's why I make sure I always have long sleeves, because I don't want people to see I don't have a Rolex. I feel ashamed about that.